You're listening to Health Professional Radio with Wayne Buckler. Today my guest is Professor Mathew Vadas. Mathew is the Executive Director of the Centenary Institute, and he joins us on HPR to tell us about the Centenary Institute and the work they're doing. Mathew, welcome to Health Professional Radio.
Oh, thank you very much. It's a pleasure to be here. The Centenary Institute, as you possibly know, is an independent medical research institute, one of quite a few in Australia. And we concentrate on understanding disease and finding cures for it. And our particular expertise is understanding the process of inflammation, which drives cancer and cardiovascular disease, as well as a number of inflammatory diseases that you've probably heard of. But in the last few years, it's been just an amazing rate of discovery of new drugs that have attacked inflammation in one way or another and have been able to improve people's lives. And this is exactly the area that the Centenary Institute is involved in.
Now, Mathew, the Institute's located in Sydney, and I gather it's closely allied with both the Royal Prince Alfred Hospital and the University of Sydney.
That's correct. In fact, it was created 30 years ago to mark the 100th anniversary of the birth of the medical faculty at Sydney University and also the Royal Prince Alfred Hospital. And so there effectively are two parents, and we have a long-term plans with both of them, which really works really well for us because the hospital gives us an enormous insight into what is important in medical research, and the university has a number of scientific tools that we use all the time, which makes it really fantastic.
And I gather that many of your faculties are both professors at the university and clinicians.
My faculty of about 12 people, about half of them are physicians or physicians in the hospital, and they run departments there. So they're the head of department of dermatology or in hematology or hepatology. It's really fantastic for us because it was a very close tie with the hospital.
Is the focus on inflammation something that's been deliberate, or is that just where research has led you to?
That's a really good question. Look, it's been an area that we've been really good at for a while, and in the past year or so, we've deliberately started to focus on it much more and more, because it's become really clear that quite fortuitously, our focus has become absolutely center point in medical research, and as I tell people, aiming and taming inflammation is going to be the next big thing for at least a couple of decades.
Certainly, it's something that we hear about here, talking to various research clinicians as being very much on the research radar. Mathew, we have an audience that is largely clinical based. We have about 95% of our listeners who are clinicians of some sort, healthcare professionals, normally in an acute setting. What's the takeaway message for them about the Institute that you'd like them to know as a result of talking to us today?
Look, there are quite a few things that I think are really important for all sorts of health professionals. One of them is to, first of all, to recognize that what the researchers like them and whom they help were working on 10, 15 years ago are now the reality of therapy. It's taken that long, but it's really borne fantastic fruit. And I think the second thing is that being involved in research, no matter how small a way, and being actually understanding what happens, is going to be more and more important in everybody's lives. So in a sense, if they can invite us to talk to them and we invite them to talk to us, I think it will work in a really synergistic way in the future.
And Mathew, what's the best way for people to get in touch with you? Is it through your website to begin that process of discussing?
Look, absolutely. It's through my website, or just email me directly, or call me, and my door is always open, and we have a tremendous amount of fun and pleasure in speaking to all sorts of people about what we do.
Now, I always get into trouble for mentioning websites because people say, you didn't warn me and I didn't have time to get my pencil ready. So listeners, pencils ready. That website is www.centenary.org.au. So that's an Australian website, www.centenary.org.au. Mathew, it's been a pleasure chatting with you today. I'm sure there are lots more things we could talk about, but time is going to beat us. If you've just joined us, you've just missed me talking with Professor Mathew Vadas, the Executive Director of the Centenary Institute in Australia. There is on our website a transcript of this interview. There's also a SoundCloud archive, and there is a YouTube archive as well. Mathew, thank you for your time today. I understand that you're travelling internationally, and I appreciate the effort you've gone to be able to talk to us.
Not at all. It's been an absolute pleasure. I hope to catch you soon.
My pleasure to have you on the station with me. This is Wayne Buckler for Health Professional Radio.